Sarah Tofte is here now, the director of Everytown for Gun Safety. Thank you for joining me.
Yes, thank you for having me.
Let's talk about gun violence as a public health issue.
It's a public health issue because of how many Americans are impacted by it every year. We know about 33,000 Americans die from gun violence every year. 2/3 of those are suicides, 1/3 of those are homicides. We know a significant number of Americans witness shootings, which have a public health impact, and 44% of Americans know someone who was shot. So when you think about the scope of gun violence in this country, it's significant and certainly suggests a public health crisis.
We know, of course, there's not one solution to preventing gun violence. Can you talk about some of the work that's being done?
Yeah, the good news is we know which policies work. We know that making sure that every gun sale goes through a background check so that we keep guns out of the hands of individuals who pose a risk to themselves or others can have a significant impact in terms of reducing gun homicides and gun suicides. We know that keeping guns out of the hands of domestic abusers in particular has a significant impact on the safety of women and children. States that prohibit domestic abusers from possessing firearms and requires them to turn in the guns they own is associated with a 14% reduction in domestic violence gun homicides in those states. We also know that keeping guns out of the hands of those that may do harm to themselves is essential to preventing suicide. Temporarily removing guns from the home from someone who may pose a risk to themselves has also had an impact on reducing those gun suicides. So good news is we know it works. Tricky thing is getting those policies, getting the support of policymakers and getting those laws in place is another question.
How does the U.S. compare to other countries in terms of gun violence?
We do not compare well. We certainly have the highest rate of gun violence of any country in the developed world. So there's just no question about it. Our gun violence problem is unique. And so we've got a lot of work to do to get ourselves in a better place.
Other than public health, what sectors should be involved in trying to prevent gun violence?
Yeah, another great question. Everyone, right? The problem is so big, so of course we need the public health community involved, researchers, doctors, and others. The criminal justice system has a significant role to play, again, making sure that we're holding gun offenders accountable and that we're also doing our part to keep guns out of the hands of, again, those that pose a risk to public safety. But all of us, right? We need policymakers, we need state, local, and federal politicians to step in and support policies we know work to reduce gun violence, and we really need the American people. Again, as I mentioned earlier, almost half of Americans know someone who has been impacted by gun violence, so all of us have something at stake here, and more of us need to get involved, again, at the local, state, and federal level to push our policymakers to do the right thing.
Such an important issue. Thank you, Sarah.